Hello, and welcome to the learning modules brought to you by Therapeutic Articulations, the developer of the Mobil-Aider orthopedic device. This learning module will focus on wrist and hand mobilizations. The mobilizations that we will discuss include a radiocarpal dorsal and volar glide for flexion and extension respectively, radiocarpal medial and lateral glides for radial and ulnar deviation respectively, as well as some intercarpal and phalangeal mobilizations. Let's start with the radiocarpal glide. The dorsal and volar glide can be performed in the supinated position you see here, in which a dorsal glide is used to facilitate flexion, and that would be a downward motion, and a volar glide would be used to facilitate extension, and that would be an upward glide. Hence the red arrow that goes in both directions. All right, dorsal glide down, volar glide up. It is really usually by convention you want to have a downward motion. It's always easier to push than it is to pull. But in the case of the hand, where it's a small anatomic structure, it's not a heavy structure that's hard to pull, you have flexibility to go either way. So you could perform this radiocarpal glide in a pronated position, where you would push down for a volar glide and pull up for a dorsal glide. Either of those are acceptable techniques. You have flexibility based on the patient's available range of motion, the position you can get them in, and the clinician's level of comfort. Here's an example of a radiocarpal glide that's used to facilitate flexion using the Mobileader device. Here you can see the white attachment, also known as the HF attachment, on the device. You can see the individual in a supinated position. The grip is exactly the same from the clinician's perspective, and here the mobilization is performed in a downward direction to facilitate flexion, right? So a radiocarpal glide is movement of the proximal carpals that are convex on the distal concave radial and ulnar articulation. So this would be convex on concave, which would mean flexion would roll anterior and glide posterior. Here's a video of that technique to see the attachment donned onto the device positioned at the joint line, stabilized proximal, and then mobilized distal. Here you see the same situation with the HF attachment, but now for a volar glide. In this case, the hand is in pronation, so the clinician is pushing down. Again, as I said, pushing is always easier than pulling. And here again, you see a volar glide to facilitate extension. Attachment is aligned with the joint line. Distal segment is moved in a volar direction. So for extension, you roll posterior, glide anterior. For medial and lateral glides of the radiocarpal joint, these can be used to facilitate radial and ulnar deviation respectively. These aren't quite as common as a clinical technique. However, things like ulnar deviation are important for gripping type tasks. Right? When we grip with our fingers, we tend to extend our wrist and ulnarly deviate. And so this could be an important component of a functional activity. Here we see a medial glide to facilitate radial deviation. And that's because, again, we have convex on concave. So a medial glide would be used to facilitate radial deviation. So radial deviation involves rolling lateral, gliding medial. Here again, you see the donning of the HF device, finding the joint line. And you're gliding medially. Again, all of the techniques with the Mobileader are the same as your regular anatomic techniques, your regular joint mobilization techniques. You're just interfacing the device in between the clinician's hands and the patient. So now you have an ulnar glide. Or, excuse me, a lateral glide for ulnar deviation. I misspoke there. It's a lateral glide for ulnar deviation. Midcarpal and intercarpal glides require very precise palpation. These bones are very small, and you must be able to identify them very exquisitely so that you can stabilize one and mobilize the other. Right, so we can do anterior and posterior glides of each of the carpal bones in order to increase their mobility. When we look at the CMC joint, the carpometacarpal joint, the glides there for the first ray, i.e. the thumb, are different than those of rays 4 through 5. Excuse me, 2 through 5. Rays 2 through 5. So the thumb, the first ray, a medial glide will facilitate flexion. A lateral glide will facilitate extension. A posterior glide will facilitate AB, or abduction, and an anterior glide will facilitate AD, or adduction. If we look at rays 2 through 5, volar or anterior glides are used for flexion, and dorsal or posterior glides are used for extension. Here we see MCP glides, metacarpophalangeal glides. A dorsal glide is for extension, and a volar glide is for flexion. We're having concave on convex, so rolling and gliding are occurring in the same direction. IP glides, again, dorsal glides are for extension and volar glides are for flexion. Here we see the distal phalanx being moved on the stabilized proximal phalanx.
If you want more information about the Mobileader device, please visit mobilizations.com. There's a whole host of other learning modules there that address joint mobilization as well as the joints which the Mobileader can be used. You can also find information about the features for the Mobileader device. For any questions, feel free to send an email to dawn@mobilizations.com. Thank you for watching this learning module.